I have seen incredible ingenuity from the community, all the way from harvesting personal protective equipment supplies like gloves and masks and gowns, to making gowns and masks for some of our community providers, to providing support to our staff through messages, through meals, through flowers, lots of support coming from the community. It's been just quite overwhelming. We've thought about that a lot, and we have worked with our foundation to set up the St. Joseph's Health Crisis Fund. The first priority for that fund is to support research. This is a new virus, and there's lots of uncertainty as to how to prevent people getting so ill with it, how to treat it, and how to support our patients, but also our staff as they deal with this crisis. And so that would be the best support. We have some incredible researchers here who have designed research that they need support to run to try and create some answers for us for tomorrow and for the next day and for the weeks and months to come. Lawson Health Research Institute is the research arm of St. Joseph's Healthcare London in partnership with London Health Sciences. We together provide hospital-based research that focuses on research that will translate into differences in care at the front line. That's the really important part of what Lawson does. And so with the emerging of this new virus, researchers are looking at how they can impact the outcomes for people with this new virus today. The most important thing that our community can do is to pay attention to the public health recommendations to physically distance, wash their hands, and stay home as much as possible. Because if you can stop the spread of this virus, it means that those of us who are working in healthcare will not have to provide care to you and many, many more people. So please pay attention to what public health is asking you to do and encourage everyone you know to do the same. Staff are very appreciative of the support that they're receiving. It helps them to know that the community appreciates what they're doing every day in coming to work, caring for individuals with or without the virus, because there's still lots of people that need care. But they also know that they are coming with a potential increased risk to themselves in coming in and providing care. And so knowing that the community appreciates them, is supporting them, and seeking ways to find answers to this new virus means an awful lot to our staff. We set up the St. Joe's Health Crisis Fund to fund research that can start now. It's not research that will start months from now, it's research that will start now to try and impact the trajectory of this particular pandemic and this virus. Experts who speak about this virus talk about the potential for a second wave, potentially in the fall, when we get to the winter season again. We need to get the research done, we need to get answers to help us to know if this virus continues circulating in our community or creates a second wave, we would be able to have answers to treat it differently. We are incredibly grateful for all the support we've received from our community. However, given the sensitivity within the healthcare system now, where we're actively screening everybody at the door and actively screening everything that comes into the healthcare organizations, we're asking people to work with the foundation to look at how they may be able to help support through the Health Crisis Fund, and then we'll use that fund to support our patients and support our staff and support the research that we need to get done.